All right. Hi, Molly. How are you doing today?
I'm doing good.
Good.
But I'm in pain.
You're in pain? What's in pain right now?
My left shoulder.
Okay.
And then sometimes my left leg when I'm trying to swim.
Gotcha. So basically what we're going to be doing today is we're going to be screening you again. I know you were already screened, but we're going to be screening you again in order to just figure out where we're going to be going from here in our occupational therapy services, and see what goals we're going to be focusing on throughout the process. And I know in your previous screen, you had some decreased ocular motor control. So basically, you're unable to like move your eye voluntarily in the way that you want to. Is that correct?
Yes, that's correct.
Okay. And then also you are unable to see out of the left field of both of your eyes.
Yes.
Is that true as well? Okay.
Very frustrating.
I bet. I can imagine. And then you said that you have pain in your left shoulder because you dislocated that. Is that correct as well?
Yes.
All right, cool. And then also your left hamstrings muscle is just like weaker than normal, and you're unable to like flex that as and use that as well as you would like. Is that true?
Yes.
Okay. All right, so we're going to first start out screening your vision. And so what I'm going to want you to do is stare straight ahead.
Okay.
Just pick a spot on the wall over there and look at that. And what I'm going to do is I'm going to bring my finger by the side of your head, and you're going to tell me when you can see that.
Okay. I can see it.
Okay. And now I'm going to do it on your left side.
Okay. I can see it.
All right. Sounds good. All right. Next, I'm going to move this pin in front of your across your visual field, and I want you to follow it as best as you can.
Okay.
Move this. All right. Thank you. All right. So next, what we're going to do is we're going to screen for your visual perception. And so first I'm just going to ask you, tell you some different fruits, and you're going to tell me the color of those fruits.
Okay.
So what color is a tangerine?
Orange.
Okay. How about a lemon?
Yellow.
And a lime?
Green.
Okay. Good job. You got all those right. All right. And then also, so I'm going to show you these three things, and I want you to tell me like what kind of category a fork, a spoon, and a knife.
Silver.
Okay, good job. Next, we're going to be screening your upper extremity deficits. And so I know that it's going to be difficult for your left side, but I want you to like do it as best as you can. We're going to avoid a few different movements because those are bad for your shoulder. We don't want to injure it anymore. All right, so for your right side, I want you first to flex that, bring that up as high as you can. All right, good. And then if you need to like scoot to the side of the chair, like extend your shoulder back behind you. Nice, that looks good. All right, now let's see that on your left side. As much as you can, stop when there's pain. All right, sounds good. And we're not going to extend that arm because that is bad for your dislocation. We don't want to hurt that anymore. And then, okay, for your right side now, I want you to raise your right arm up to your side. All right, nice. Can you go any higher than that? There you go. Nice. All right, and then let's do that. Then you're good. You can bring it down. And then on your left side, let's try the same thing. All right, some weakness there for sure. All right, and then let's bring your right arm, flex it, and then bring it across your body. All right, cool. And then for your left arm, we're not going to go out because that's bad for your shoulder as well, but just try to bring that in as much as you can. All right. And then that last one, we're going to shrug your shoulder on your right side as high as you can. All right, good. And then shrug your shoulder on your left side. All right. All right, next we're going to screen for those for that lower extremity. And so basically, what I want you to do is just like shift weight as much as you can on your right side. So like pick your right side up. All right, cool. And then pick your left side up as much as you can.
Wait, I think I put it on.
Okay, yeah.
But shift the other way.
Yep. So shift on your right side. Yep. Try to raise that right side up. And then shift your left side as much as you can. Mm-hmm. Okay. A little weakness there. Did that hurt at all, or just a little bit? Okay. And did anything with your shoulders hurt at all? Like you stopped it where it started hurting, but like okay, sounds good. All right. So basically, through that, what we also we're going to try to sit to stand as well. So if you can try to stand as best you can. I know your left leg is weak. Okay, cool. Sounds good. It looked like you were like putting most of that weight through your right foot. Is that true? Okay. All right. So basically, through what we found through this is basically what was already known. Like your left side is quite a bit weaker, and so we're going to be trying to work on like improving that and improving your vision as well through this process to try to get as much of that back as we can. Some safety concerns that I want you to like go by through this process is for your eyes. We can't have you driving at all since you can't see out of that left field of vision. So unfortunately, you can't be driving. I know you have a husband, right? That can drive you around. Okay, cool.
I would hope so.
All right, so he can do that for you, and if you have any friends that live near you too, they can do that, take you to and from like appointments or whatever. But in order to be safe, we don't want you to be doing that quite yet. And then for your shoulder, like I had said, like it can't be extending your shoulder at all through this process. And then also no lifting any like weighted items with that left shoulder. So as much as lifting you can do on your right side, we'll try to do that. And then also no external rotation of your left shoulder either, just to prevent like further injury. And then for your for like mobility and moving around, since your left leg is impaired, I want you to be using your walker as much as possible, but I want you to use that only when there's like someone around, just to be safe. Otherwise, I want you to like be in your wheelchair for now, since that's still pretty weak. So the next step we're going to take is we're going to have an eval for you, and so this will be more hands-on thing where we're going to be assessing like your strengths in different activities, and so it'll be more interactive than this screening was. And so we're going to have that next, and then we're probably going to recommend you for like OT services, maybe even PT services with your gait, since your lower extremity is impaired too. First off, I think we're going to start probably doing like 2 to 3 times a week for like 30-minute sessions each. But we'll figure that out after the evaluation that you go to next time. And then some interventions that you could be working on through this until you come back for that evaluation, just to kind of like improve that, like those muscles in your eyes and shoulder and legs, to kind of get those moving a little bit. For your eyes, what you can do is practice moving it, like what I did with that pin. Like try practice moving your eyes following that pin throughout the day. Like do that 2 to 3 times a day. Go across your eye 3 times, 2 to 3 times a day. And then you could also be doing some passive range of motion for your shoulder, so your husband can help you with this, or your friends. So what I want you to do is like lay down on a bed or the floor, whatever, probably preferably a bed since your left leg is weaker than normal. So lay down on your bed, and then your husband will like bring your shoulder through the whole range of motion for you, or to the point where it starts to hurt. And then for your legs, what I want you to do is just throughout the day try like lifting that up with your right arm as much as you can, just to kind of like get it moving so that um, you don't develop pressure sores from your wheelchair, and so that those muscles just kind of like get that feeling of moving. Like you can either even like use your right arm or your right leg to kind of like bring your like flex and extend your knee to get those muscles kind of activated again. And besides that, we'll see you next time for your evaluation, and then we'll figure out like where we're going to go from there.
Sounds good.
All right. Thank you.
You are welcome.